Thank you, Madam Bekele-Thomas, Minister Chiponda. Very nice seeing you again, Dr. Kuwande, and also, of course, Dr. Alakija. Really great and energetic panel, which is hard to do at the end of a session. I have the pleasure now of introducing everyone to some of our closing speakers. First, I know that we have talked a lot about the Africa CDC, and I know that they are in the midst of their own convening in Rwanda this week, but we do have a special message from their acting director, Dr. Ahmed Ouma. With that, I would like for us to tune in for his remarks on the screen. Thank you.
Your Excellencies, our heads of states from Africa, our co-host, Secretary Becerra, all ministers, heads of institutions that are present here today, I send you very warm greetings from Africa. At Africa CDC, we take our mandate of safeguarding Africa's health very seriously. The lessons that we've learned during this pandemic are very clear for us that we must and we need to work with partners to be able to do even more for the continent of Africa. Health security globally is not complete until every part of this world is safe from outbreaks and disease threats. Africa is willing, able, and ready to do its part. We are asking you as our partners to join us in implementing the new public health order so that we can be able to do things differently, to be able to achieve different and better results. A core part of the new public health order is partnerships. Sustainable partnerships that are respectful of Africa's priorities, sustainable partnerships that are action-oriented and are going to deliver even more better and bolder results for the continent. As we leave the acute phase of the COVID-19 pandemic, let us carry the lessons that we have learned and let us implement those actions that are going to ensure that we never have to repeat these lessons again. Africa CDC is ready to work with all our partners so that we can be able to secure the continent from disease threats and outbreaks, and that is the only way that the health security architecture for the world is going to be even more secure than it is today. Africa is part of the solution, and we are inviting you as our partners to work with us so that we can be able to achieve those that have been eluding us over the past many decades. We are safer together. I thank you.
We're certainly grateful for those remarks from Dr. Ouma, and of course are grateful for our ongoing and enduring partnership with the Africa CDC. On that note, I'd like to introduce another special guest to close us out, Dr. Rochelle Walensky, who is, of course, the director of our Centers for Disease Control and Prevention, as well as the administrator of the Agency for Toxic Substances and Disease Registry. Dr. Walensky has done quite a lot in the world of public health, including in the fight against HIV/AIDS, and I don't know if many people are aware of her storied career in that space, but we are grateful for her service both domestically and internationally in that regard. In addition, just before coming on board as our CDC director, she served as the chief of Division of Infectious Diseases at Massachusetts General Hospital, and was a professor of medicine at the Harvard Medical School until 2020. Of course, she has a number of degrees, including a Doctor of Medicine from Johns Hopkins School of Medicine and a Master of Public Health from Harvard School of Public Health, and we're just grateful for her being with us today. Dr. Walensky.
Thank you, Assistant Secretary Pace. It's truly an honor to be with all of you today and to really close out my today's important summit with my thoughts. Let me also thank President Biden for hosting this summit, Secretary Becerra, His Excellency President Museveni and His Excellency President Masisi for opening this health session, and all the distinguished leaders, ministers, and partners for traveling to DC to be part of this critical summit. And I extend my thanks to my colleague, Dr. Uma, for his video message, particularly given his need also to focus on the second International Conference on Public Health in Africa, which is actually occurring simultaneously in Kigali right now. Today, we've talked about the importance of our partnerships and what we can do together to address Africa's health security threats and workforce needs, and how we can continue to build resilient systems that will serve Africa for years to come, building on the public health investments and the long-standing and extensive collaborations we have developed over the decades on the African continent. Indeed, CDC has over 1,300 staff in 33 country offices in Africa, working closely with ministries of health, local partners, the WHO, and others with the shared goals of improving health and health security for all. Our approach prioritizes host country ownership, investment in local partnerships, development of sustainable capabilities, sharing of technical expertise, and building and promoting a robust public health workforce. So today, I'm happy to announce several new and expanded initiatives. Public health experts all over the world recognize the need to establish pathogen genomics surveillance capacity. While there is ample support to purchase equipment and develop online trainings and in-person workshops, as you've just heard, support for bioinformatics is actually the biggest challenge. Educational programs in Africa are just beginning to be developed in this field, and since the field is so new, there are few people actually to provide that mentorship. Therefore, CDC in the US is working with Africa CDC to place an expert in public health bioinformatics on the continent to provide support and mentorship. Filling this position will have immeasurable impact and be a valuable and sustainable tool for health diplomacy in this emerging field. The Field Epidemiology Training Program, FETP, is recognized worldwide as an effective means to strengthen capacity to prevent, detect, and respond to public health threats through enhanced surveillance, epidemiology, and outbreak response functions. CDC has helped train more than 10,000 disease detectives in 34 sub-Saharan African countries through FETP, and for the coming year, there are expansion activities planned in Mauritania, Ethiopia, and Nigeria. This is very exciting. About 80% of FETP graduates remain in their country's public health sector following completion of the program, and many are also leaders and managers in their own organizations. So building this workforce truly strengthens our capacity to address emerging and endemic health threats. Starting in February 2023, CDC will pilot an FETP frontline curriculum in Cameroon and Kenya, incorporating One Health principles. These pilots will expand the ability of FETP graduates to conduct multi-sector outbreak investigations that explore the important intersection between humans and animals and the environment. In recent years, FETP has also expanded in some countries to include a focus on non-communicable diseases, or NCDs, and associated risk factors. For example, in 2019, the Ethiopia Field Epidemiology and Laboratory Training Program in the Ethiopia Public Health Institute established a training program focusing on cardiovascular disease risk factors. The program works with the Ministry of Health, universities, and Resolve to Save Lives to support and mentor advanced level trainees. They're also currently recruiting the 4th NCD cohort, increasing their capacity to address non-communicable diseases and build a workforce trained in communicable and non-communicable disease field epidemiology. Through CDC's collaboration with many global partners, the Global Laboratory Laboratory Leadership Program, or GLLP, fosters and mentors laboratory leaders of today and for the future to build and to strengthen and to sustain national laboratory systems around a One Health focus. This aligns with a long-term goal and priority of Africa's CDC's Biosafety and Biosecurity Initiative to provide training to strengthen national laboratories and institutes. The program has grown from one African country, Liberia, in 2017 to 16 African countries in planning or implementation stages in 2022. And planning is underway to implement the program in several East African countries in 2023. Burkina Faso is one of the first countries to take steps to incorporate the program into existing continuous education programs. By working with local medical and agricultural universities in 2022, CDC began the process to integrate the program into the Joseph Kierbo University diploma in Ouagadougou. The key objective of the GLLP is developing a sustainable program owned by the country that can be adapted and integrated into the university's curriculum. CDC is actively working both locally and within each country region to reduce the personal safety risk from infectious diseases threats facing healthcare personnel across Africa through a number of initiatives and programs, working closely and collaboratively with implementing partners. These efforts involve healthcare worker surveillance to quickly detect COVID-19 and COVID-19 breakthrough infections, facility-based comprehensive safety assessments and quality improvement initiatives to ensure continuity of essential health functions, infectious disease threat rapid detection and response networks, healthcare worker training, supportive supervision, and regional communities of practice, and technical expertise engagement with ministries of health to ensure implementation consistent with global norms and sustainability. In the next year, CDC is excited to expand healthcare personnel safety training to new cohorts and to pilot new sites in Sierra Leone, Nigeria, Uganda, and the Democratic Republic of the Congo. As most of you are aware, earlier this year, the U.S. government and the African Union signed a renewed memorandum of cooperation outlining goals and objectives for our partnership with Africa CDC, expanding upon previous agreements. This demonstrates our continued commitment to exchanging best practices, supporting global health security capacity building, expanding and strengthening the health workforce, and supporting health commodity manufacturing capacity across Africa, always keeping in mind locally identified needs. So much strategic, thoughtful, and hard work went into that renewed memorandum of cooperation, and I thank all who are involved. We are looking forward to working with partners at Africa CDC and our country partners in implementing the Memorandum of Cooperation through the Joint Action Plan, which we are working to finalize in the coming weeks. When I mentioned earlier that CDC has 1,300 staff in 33 countries across Africa, what I didn't say is that more than 1,000 of them are locally employed staff, citizens of the country, or sometimes third country nationals. Our locally employed staff provide critical, scientific, programmatic, and administrative leadership and support across a variety of roles. They are truly the backbone of our global workforce, especially because they have the long-term relationships with ministries of health and country governments, deep historical knowledge and institutional memory, and serve as critical bridges to local partners. Our locally employed staff often rise to the challenge of complex environments and have ensured continuity of country office operations through many years and often even decades, including and especially during times of crisis. Across the continent, they are engaged in innovative work, and their dedication and commitment has been integral to the success of our country offices in Africa and beyond. Our global successes truly belong to our health workforce, including our locally employed staff colleagues. Our commitment and support to maintaining and elevating the health workforce has been, is, and will continue to be a top priority. Thank you again for the opportunity and the privilege to join you all today.
Okay, ladies and gentlemen, we have reached the end of this epic and informative session. I will just take the time now to thank everyone for joining us, for being so engaged, for being so enthusiastic, in fact, about everything that was discussed, from the various calls to action on workforce and innovation to the broad commitments to partnership and trust. I have the pleasure now of introducing our final speaker. She is joining us by video and a pre-recorded message, but we wanted to make sure and give her a voice for our in-person and online audience today. Of course, that's Her Excellency, former President Ellen Johnson Sirleaf of the Republic of Liberia. And I think she probably needs no introduction, but we all know how committed she is to freedom, peace, justice, women's empowerment, and democracy. Of course, during her terms as president, she did quite a bit, not only in the space of health, but beyond, and continues to be a leader, particularly around global health security in recent years. And so again, I thank all of you who joined us online. I thank all of you who joined us in person. And with that, would like to introduce Her Excellency, Madam Johnson Sirleaf. Thank you again, everyone.
Excellencies, we come together following a hard period of setbacks, but also great optimism about what can be achieved on the African continent. I speak to you today as a former president with lived experience and lessons from managing the West Africa Ebola outbreak of 2014-2016, and as former co-chair of the Independent Panel for Pandemic Preparedness and Response. The independent panel made a series of recommendations to transform the global system to stop outbreaks from becoming pandemics of such devastation as COVID-19. First, I'd like to speak about lessons from Ebola. Ebola taught us that bringing a deadly virus under control is a matter for all of government and all of society. When Liberia was struck, I brought together the cabinet. We worked across ministries, and vitally we worked with communities, with business and religious leaders, with community leaders and leaders of political subdivisions of counties and districts. I even wrote a letter to the world. Leadership happened at every level. Partnerships were also key, including, of course, with the United States, the World Health Organization, Médecins Sans Frontières, and many others. Together, we beat Ebola. A lesson was the importance of investment in strong health systems. This includes investment in people primary care, doctors, nurses, researchers, and laboratory technicians. I believe professional community health workers, properly trained, equipped, supervised, and paid, are best prepared to provide essential health services in their communities. The people health systems are meant to serve. Another lesson was regional solidarity and the importance of cross-border cooperation. We took those lessons to the COVID-19 fight. I remember the African continent was the first to join forces. On February 22, 2020, health ministers of the African Union came together in an emergency meeting and resolved to work together to share information and coordinate control measures. The Africa CDC, just 3 years into its mandate, worked quickly to support countries faced with a new virus of which we knew very little. The COVID-19 pandemic exposed African countries to substantial health, economic, and social harm. No continent was spared. Even the wealthiest countries in the global north, deemed the most prepared, suffered gravely. But the pandemic also showed clearly that more than ever, the African continent must and can be more self-sufficient. The inequitable response to COVID-19 put us last in the queue for vaccines, treatments, and diagnosis tests. The pandemic exposed inequities in access to critical medical products like vaccines and tests, in access to capacity building, in access to healthcare systems, and exposed our communities to misinformation. To begin to address inequities, the Independent Panel for Pandemic and Preparedness and Response recommended a new system to research, trial, manufacture, and distribute tools like vaccines, treatments, and tests. They should be made much closer to the place that require them in Africa and the world. Africa's plan to manufacture and produce the up to 60% of vaccines intended for the continent by 2040 will need support from the United States and other countries to reach these targets. This means technology, innovation, investing in African researchers, African laboratories, African manufacturing and distribution, and also in community mobilization, health information, and demand. We need to be ready to respond rapidly to outbreaks at their source, including with products that suit the reality of African countries' climate and geography. The independent panel also recommended a sustained fund for pandemic preparedness and response be established. A pandemic fund now exists and will soon be put out a first call for proposals. The United States has shown great leadership to help make this happen. Rwanda's Minister of Health is a co-chair of the fund. The African Development Bank is an implementing entity, but we need this fund to grow. It now has about 1/10 of the 10.5 billion US needed annually. The panel recommended a financing model whereby all countries pay what they can, and the countries requiring the most support can rely on getting it. I encourage our African countries to be involved in this fund, to advocate for the funds required, to make proposals for funding, and to invest nationally in pandemic preparedness and response. On health workforce, Dr. Ahmed of the Africa CDC shared the vision of Africa's new public health order. The new public health order prescribed the leadership and commitment we need to meet the health workforce needs, including doctors, nurses, midwives, and the 2 million community health workers that the AU has set as a target. I see momentum already. In support of this strategy, earlier this year, I launched the Africa Frontline First Initiative and a catalytic fund hosted by the Global Fund, which has mobilized nearly $100 million to strengthen the community health workforce in Africa. In Geneva, there are processes underway to amend the international health regulations and to negotiate a new pandemic accord. Here are opportunities to address issues of equity, financing, and health systems to encourage the African states to fulsomely take part in these processes, which will define the way the world prevents, prepares for response to pandemic threats. Finally, at the United Nations General Assembly in New York, there will be a high-level meeting for pandemic prevention, preparedness, and response no later than the end of September 2023. South Africa's leadership was central to making this happen. The independent panel has recommended that to truly transform the international system for pandemic preparedness and response, we require a Global Health Threats Council to bring the system together. This will be comprised of heads of states, inclusive and representative of all countries. The political declaration that will result from the high-level meeting is an opportunity to call for such a threats council. I stress again, and all of us here learned in this pandemic, that pandemic threats must be tackled as whole of government and whole of society issues. It requires accountability and action from the highest levels of political leadership. The Ebola outbreak could not have ended without presidential leadership. I urge you to take this same approach to pandemic threats and harness what we have learned from the COVID-19 pandemic to ensure the continent has the resilient health workforce and health systems that it needs to continue responding to this pandemic while also preparing for the next. The future of our African continent and of the entire world is in your hands. Let us safeguard our health and secure a brighter future. Thank you.
This brings us to the end of our program. We would love to thank all of our panelists, our heads of state, and everyone who attended today. Thank you and enjoy the rest of the summit. Have a good one.